Good afternoon, sir. My name is Dwayne Kaifer Enselias, a student nurse from the SM1D. So today I will be performing assessment in the musculoskeletal system. So the first procedure is assess the client's physical and psychological aspects before and during the examination. This allows the healthcare providers to gather complete data about the client's health status. So, hello sir. Good morning po. My name is Dwayne Kaifer Enselias, student nurse from the SM1D. So, may nararamdaman po kayong sakit sir or anything man?
Wala naman.
Wala naman po. So the client is fine. Procedure number 2 is review the body areas to be examined. This helps the healthcare examiner or healthcare provider to identify which part of the body is to be examined systematically. So the parts of the body to be examined here in the musculoskeletal system are the muscles, joints, and tendons. So, kung saan po yung mga areas na may mga joints or tendons, sir, give po natin ng extra attention. So, yun po. Procedure number 3 is make a physical and environmental preparation before the examination. Proper preparation of environment, client, and equipment ensures smooth physical examination with few interruptions. So in this room, it's appropriate po sir because it's quiet, so hindi po tayo interrupt. Procedure number 4 is determine and prepare the materials or equipment to be needed. The only equipment to be needed is the percussion hammer. So the rationale for this is to save time and effort of the healthcare provider. Procedure number 5 is identify the client to ensure that you are administering the right procedure to the right client. So, good afternoon sir, my name is Ben Kaifer Enselias, a student nurse from the SM1D. So, may I know what your name is po?
Si Ivan Rodrigo.
So, ito po si patient Manrigan po. So, yun po, you have identified the client. So, next is explain the procedure to the client. So, explaining the procedure to the client reduces anxiety in the client. So, good morning, sir. So, today I am going to perform the assessment of the musculoskeletal system. So, sir, what I need you to do is just follow instructions. Tapos, magsabi ka lang po kung may naramdaman ka na masakit or ano man or any types of pain po. And also, magsabi ka if uncomfy ka or ano man. Okay po, sir? Next is procedure number 7. Properly position the client. Proper positioning of the client ensures easy access to the body parts to be assessed and it makes the client comfortable. So, sir, can you sit up straight po? Yeah. Procedure number 8 is take the health history of the client. So the rationale is to have a comparison of results with the client's previous illness to his or her present condition. So, sir, in your family, do you have history of suffering from muscle pain or mga tingling sensations po, mga ganun?
Wala naman.
Kayo po, sir, meron po kayong experience these past few days or weeks?
Wala po.
So, bakit po kayo nagpasa, sir?
Magpa-check up na po siya.
Okay, pa-check up po, sir. So, the next is procedure number 9 is conduct physical examination using the 4 skills of physical assessment. The inspection, palpation, percussion, and auscultation. The 5th one is olfaction, pero hindi yung nagamit today. So, the rationale is to assess, determine, and identify abnormal findings in the body system. So, ito na po, mag-perform na po tayo ng physical examination. So, procedure number 10 is inspect the muscles for size. Compare the muscles on one side of the body to the same muscle on the other side. And this is to measure for any discrepancies and measure with a measuring tape. So, the method to be used here is inspection. Ideally, the muscle should be equal in size on both sides of the body. So, Excuse me, sir. So I will be inspecting you po for any discrepancies po sa muscle ko, ha? Stand up straight po, sir. Same po, sir. Right. Just like. Na naman po discrepancies, sir. So, moving on to procedure number 11 is inspect the muscles and tendons for any contractures. So, the method to be used there is inspection. So, ideally, there should be no swelling and no contractures. So, sir, can you contract your arms po? Again, ganun na po. Yan. Ang legs mo po, sir, pwede mo yung so, no, wala po ang contractures natin. So procedure number 12 is inspect the muscles for tremors. For example, by having the client hold the arms out in front of the body. So the method to be used here is inspection. So ideally, there should be no tremors po. So sir, I have a request for you again, sir. Can you hold your arms out like this? Wala naman po tremors present, sir. How about your legs, sir? No tremors present, sir. And next is procedure number 13. Test muscle strength. Compare the right side with the left side. So the first muscle that you are going to test here is the sternocleidomastoid. Have the client turn his or her head against the resistance of your hand. So and repeat it on the other side. So the way you perform this, sir, is ganito po, and have the client resist the force in your hand. Sige po, sir, yung turn to your right. Excuse me, sir, dito yung isura. So, okay po. So ideally, normal finding should be equal strength on both sides. So the next is the trapezius. The client in the trapezius, the client shrugs the shoulders against the resistance of your hands. So how to do this, sir, is you put your hands dito po sa shoulders ng client mo and pa-request mo na i-resist niya po yung force. So sige po, sir, can you resist? Yan po. Equal po ang strength. Letter C is the deltoid. So client holds the arms up and resist while you try to push it down. So paano to gawin, sir, is you have your client holding their arm like this, tapos i-force mo down yung hand mo sa arm sila, tapos try to resist. So excuse me, sir, can you hold your arms up like this? So, i-resist mo po, sir, ha? Equal po ang strength ng deltoids niya. And the next is the biceps. So, client fully extends each arm and tries to flex it. While you attempt to hold the arm in extension. So, what you're going to do, sir, is pa-hold out mo yung client, yung arms niya out in front, tapos i-order mo siya na i-flex, and then you try to put as much resistance para ma-flex para matest yung strength ng biceps ng yung client. So sir, can you do this po? Sige po, sir. Resist. Full strength po. The next is the triceps. So client flexes each arm and then tries to extend it against your attempt to keep the arm in flexion. So what you're going to do is have the client do this, tapos mag-apply po ng force or resistance, sir, tapos have the client push his or her arm outward po. So excuse me po, sir. So can you do this po, sir? So I want you to push it outward, sir. Push your arms outward. that's para sa isa. And next is the wrist and finger muscles. So client spreads the fingers and resist as you attempt to push the fingers together. So para by two po to, sir. Like i-take mo po yung fingers mo, tapos ganun mo po yung sa fingers ng client, tapos i-instruct mo ang client na pry niya open yung fingers mo, or pry niya open yung fingers mo. So, excuse me, sir. So, I want you to push my fingers upward po siya. 1, 2, 3, go. So, may strength po siya sa fingers, sir. And the next is grip strength. So, client grasps his or her index and middle fingers while you try to pull the fingers out. So, ang gawin mo, sir, is you have your index and middle finger. So, ipag-grab po to sa yung patient. Tapos, you try to pull. Ikaw po mag-pull, and then your client tries to pull your fingers. So, pull it. Okay. So, equal pang grip strength niya. The next is the hip muscles. So, client is in the supine position. Both legs are extended. Client raises one leg at a time while you attempt to hold it down. So, dapat nakahiga po yung client mo. So, sir, I want you to lie down po. So, sir, can you raise it up po? Ito po. Saan po? Client has equal strength on his hips. So the next is the hip abduction. Client is still in the supine position. Both legs are extended. Place your hands on the lateral surface of each knee. The client spreads his or her legs apart against the resistance of your hands po. So what to do here, sir, is you put your client's legs together, tapos lateral surface po ng knee, so dito po, and instruct the client na i-open yung legs niya. So sir, can you open your legs mo? Try to feel the resistance. Ito. Equal strength po, sir. The next is hip adduction. So in this procedure, the client is still in the supine position. So what you're going to do is place your hands in between the knees, and the client brings his or her legs together against the resistance of your hands po. So gawin dito, sir, is since in between the knees, sir, you put your hands like this, tapos instruct the client to put his or her legs together. Sweet, sir. Equal strength po. So the next is the hamstrings. So your client is still in the supine position with both knees bent, and while having the client resist the attempt to straighten the leg. So, dapat may slight bend po. So, excuse me. So, sir, can you... So, yun po sir, like, the client has equal strength in his hamstrings. So, the next is the quads or quadriceps. The client is still in the supine position and the knee partially extended. Client, ask the client to resist while you attempt to flex the knee. So, extend it po, sir. So the next is the muscles of the ankles and the feet. So client resists while you attempt to dorsiflex the foot and again resist while you attempt to flex the foot. So ang gawin nito sir is you instruct the client to push your arm outward tapos i-pull mo po tapos i-strike mo po yung full power ng paa niya. So sige sir, pull po. Yan. Sige po sir. Pull po. Equal strength po sir. So normal findings pa rin po. So the next is procedure number 14. So inspect the skeleton for structure. So since inspect na po, so the method to be used is inspection. So ideally there should be no deformities po. So sir, can you lay down on the keyboard? No deformities po sir. So the next is procedure number 15. Palpate the bones to locate any areas of edema or tenderness. The method to be used here is palpation. So ideally there should be no tenderness or swelling. So excuse me sir. So palpate tendons of the bones. No signs of tenderness or swelling po sir. So the next is procedure number 16. Inspect and palpate the joints for tenderness, smoothness of movement, crepitation, swelling and presence of any nodules. So the method to be used here is still palpation, and ideally there should be no swelling, tenderness, and no nodules. So the joints. I still indicate normal findings po, sir. So, hindi po siya, no abnormalities presence po. So, since sa checklist po, sir, merong procedure number 17 is the same lang po siya dun sa procedure number 15. So, no need na po i-dictate. So, mag-move na po ako sa procedure number 18. So, sunod naman po sir is you'll be assessing the neurological functions of the musculoskeletal system. So So the first that you are going to assess is the reflexes, the bicep reflex. The patient's elbow is slightly bent forward while your arm is supporting the patient's arm. By placing your forearm diagonally underneath the patient's arm, strike the biceps with the percussion hammer. So the method to be used here is percussion. So rationale is the contraction of the biceps can be seen and felt. So dapat magalaw po ang patient. So sir, I want you to sit down, sir. Ito ba yung percussion hammer, sir? So the next is procedure number 19. So sa bicep reflexes po na ating patient, sir, nag-respond po siya, and biceps can like nag-react po siya upon percussion. So the next is the tricep reflex. The patient's elbow is lifted and bent while hanging freely with your hand supporting the patient's arm by holding the distal humerus. Strike the triceps tendon using the percussion hammer. So the method to be used here is percussion po. So the contraction of the triceps can be seen as the elbow extends. So gawin po sir, pag ganun po yung arm ng yung Ryan. So ito sir. Excuse me po sir ha. Good luck, sir. Saan ba? Anak. So, okay na po sir. The next is procedure number 20. So, the knee. The patient must be in the sitting position. The patella is struck with the percussion hammer. If the patient is lying down, the reflex is tested while the examiner's hands are placed under the knees to bend them. So, sir, may technical difficulties na po kayo na nabusan ng solution po. Sir. Opposite ako. So, yun po, sir, nag-flex po ang, or nag-react po yung knees ng aking patient. So, goods po. So, the next is procedure number 21. Ankle. Next is, you will percuss the ankle. So, the leg is bent at the knee and the foot is supported in a walling position. So, the Achilles tendon is struck with the percussion hammer. So, dito po, sir. Right, sir. Dito. So, the method we use here is percussion. So, the rationale is the foot jerks and moves downward. So, yes, sir. Sabi pa konti.
Hindi makita sa video.
Right. So, nag-reflex po yung paa ng aking patient kasi. So, the next is plantar. The plantar reflex. So, the lateral aspect of the sole of the foot is stroked with an object. So, stroke the lateral border of the sole of the client's foot, starting at the heel, continuing to the ball of the foot, and proceeding across the ball of the foot toward the large toe. So the method to be used here is percussion. The rationale here is the toes bend or curl kasi yan po yung reflex or nakikinig po yung foot ng ating client. So sir, can you sit down po? So the next is reposition the client to ensure the client is in a comfortable position or in comfort. So sir, ito po tayo. So the next is evaluation. Make findings of health assessment and physical examination done on the client. So the rationale for this is these are important data used to convey to the physician to aid in the diagnosis of the patient. And lastly is documentation, record or document any pertinent findings found during the assessment to appropriate personnel. This is to provide accurate data in the care of the client. So, sir, wala man pong naramdaman na pain or discomfort during the procedure?
Wala lang.
So, based on the findings po, sir, wala naman po abnormal reflexes or any imbalance sa muscle mo or mga signs of mga lumps or mga namamaga. So, goods po. So, normal findings po. I-report ko lang po sa iyong physician po, sir, para sana po ma-give ng proper na evaluation po. So, yun na po, sir. Tapos na po. So, thank you. Sir, may minor inconvenience na po kanina, sir. Kay naubusan storage.